Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Local complications of thiopentone sodium. Local complications of thiopentone sodium are mainly due to the alkalinity. That is, if thiopentone sodium is injected either peravenously or has intramuscular injections, because the thiopentone sodium has high alkalinity, these will precipitate in acidic pH. So in perivenous or intramuscular injections, the thiopentone sodium gets precipitated in acidic pH, and thus this will lead to the blockade of microcirculation. This blockade of microcirculation leads to the formation of local gangrene and necrosis. So treatment of perivenous or intramuscular injections is by injecting with lignocaine. Treatment is injection lignocaine. Prevention. For preventing this local necrosis or gangrene formation, you should inject the thiopentone sodium slowly, and it should be injected as 2.5% percentage. Second, local complications number 2. Thiopentone sodium may sometimes be injected as intra-arterial injections. So if injected as intra-arterial injections, because thiopentone sodium, it has high alkaline pH, it gets precipitated in acidic pH, thus resulting in endothelial injury leading to vasospasm. Prevention. In order to prevent the vasospasm, do not inject thiopentone sodium in the antecubital fossa. Use thiopentone sodium as 2.5% and inject it slowly. If there is pain, stop the injection. So treatment of thiopentone sodium intra-arterial injections. If the thiopentone sodium is given intra-arterially by mistake, then do not remove the needle or cannula. Second, vasodilators like papaverine, alpha blockers and lignocaine are injected. Stellate ganglion block or brachial plexus block can be done. Heparin can be given orally. Anticoagulants. Heparin is an oral anticoagulant which can be given for 7 to 14 days. Contraindication of thiopentone sodium. Thiopentone sodium is absolutely contraindicated in porphyria. Relative contraindications of thiopentone sodium include asthma, especially it will precipitate bronchospasm, and hypotension is also seen. Local complications of the thiopentone sodium. It is mainly because of alkalinity. Two types: one, perivenous IM injections; second, intravenous injections. On perivenous or intramuscular injections, because of the alkalinity, the thiopentone sodium will precipitate in acidic pH, resulting in blockage of microcirculation, leading to gangrene and necrosis. Treatment of this gangrene or necrosis is by giving lignocaine. Prevention is by we have to inject slowly in the dosage of 2.5 percentage. If the thiopentone sodium is given intra-arterial injections, then whenever there is alkaline pH, it has alkaline pH, so it will precipitate in acidic pH, resulting in endothelial injury, which results in vasospasm. So for this, prevention of this intra-arterial injection can be done by not injecting in antecubital fossa, and give 2.5% solution is used. Inject slowly, and if there is pain, you will have to stop the injection. Treatment of this is, first, we should not remove the cannula or needle. Vasodilators are given like papaverine, alpha blockers and lignocaines are given. Stellate ganglion block or brachial plexus block can be used. Heparin can be given for 7 to 14 days. Then contraindications are absolute contraindications and relative contraindications. Absolute contraindications is porphyria. Except porphyria cutaneous tarda, you can give this thiopentone sodium, whereas relative contraindications are asthma and hypotension.
Thank you and thank you for watching.